So you should keep your hand on baby's forehead, use your fingers, and that way we can see air moving in and out of baby's mouth. This is the healthcare pathway here in Natomas High, and the program was created to kind of expose students to the healthcare profession. So we talk about all different healthcare professions here, doctors, nurses, X-ray tech. My goal is to expose them to as many different professions as possible and also to give them some kind of direct experience working with patients, performing some hands-on skills.
I was kind of interested in the health pathway. It's kind of exciting because you learn new things that you need to learn to save somebody.
During the COVID outbreak, the worst part of the COVID outbreak, we did 30,000 vaccinations here on campus, and my students were directly involved in all aspects of that other than giving the actual injections. So they did intakes for the patients, they did coordination, getting patients to the right areas, they did prep work, and then as part of the program in the second year, they get to go and volunteer with our health clinic, and I'm hoping to expand that next year when we have access to our own health clinic into allowing them to start doing that in the first year. It's a little more dangerous, but we might need this if the baby had a lot of airway resistance. I worked as a paramedic for just about 20 years, and that's a lot of experience to bring to a table to share with students. I'm telling them how to put on a splint, and I've tried every way to do a splint before. And so I bring that experience. Here's what will work, and here's what won't work, and here's how to help with that situation. And then I also bring the experience of, here's some of the struggles you'll face, both emotionally and physically, as a medical provider.
It's gonna hurt. Like, nothing we can do to stop the hurt. We don't have painkillers right now.
For college, I'm going to study to become a nurse. My mom's really excited for me to do this class. She thinks it's really important for me to have these skills. I just like helping people, and if I have this, what we're doing today, I'm splinting. If I have this knowledge, I could help people outside of the classroom.
So definitely the largest portion of the class seems to be interested in the nursing pathway. It's a popular option coming out of the class, and I've had many students leave from here and go directly to a nursing program. But I've had students who are interested in things like vascular tech, radiologist, medical assistant, and then I also get a certain percentage that's interested in emergency medical services like EMT, paramedic, and we have connections and pathways to help students go in all of those different directions.
I want to become a nurse when I'm older. I see myself as someone that can help people. I would say that this is a great way to find out if you like the health industry and if you're interested in joining.
So I hope that students leave this experience with a few things. I hope they leave with some desire to help and make a difference. Because that's really what medicine is about. It's helping and making a difference in people's lives. Whether they choose to go into medicine or into a different profession, I hope they leave with the desire to help and make a difference in their community.